Neurodevelopmental disorders are those that occur because of neural development. Shocking. We're primarily talking here about two different disorders, ADHD and autism spectrum disorder. These tend to be ones that, because they are due to the development of the brain, um, and you end up with sort of characteristic response patterns in the brain. These tend to be ones that don't necessarily go away when you hit adulthood in the same way that a lot of our other childhood disorders do. So let's talk about these one by one. Okay, ADHD. These are children who have excessive difficulty sitting still and staying on task and paying attention, right? And when we're talking about this, there has been some controversy over the years as we've talked about ADHD, where some of these symptoms sound just like kids being kids, right? Um, all kids have a hard time sitting still. All kids have a hard time paying attention and staying on the tasks that their parents want them to do. However, we're talking about in comparison to the average peer level, right? So compared to other kids your age, are you able to pay attention for a certain amount of time, sit still for a certain amount of time, and do what you're asked to? Um, now, you can have some variety of symptoms here in terms of which are more prevalent. You may have some kids that have more problem with the inattentiveness aspect of it, and others that have more problems with the hyperactivity. But either way, it sort of gets lumped under ADHD. In order to receive a diagnosis of ADHD, um, you need to also have either learning or communication problems, be having trouble in school, be having trouble with your interactions with other kids. Um, you need to be getting in trouble, be having some behavioral problems, and mood or anxiety disorder problems as well. Not necessarily all of these, but at least one or some of these. Um, Now, why does ADHD occur? Well, there's a variety of, much like most of our disorders, there's a variety of factors that play into this. There are biological differences that seem to, uh, in this case, be strongly implicated in the production of dopamine. So you get abnormal levels of dopamine, and then differences in the growth of the frontal striatal region of the brain. Um, but then the other factors that seem to play into this are high levels of stress and family dysfunction. Now, there's probably somebody watching this video who's like, hey, I was diagnosed with ADHD and my family's fine, thank you very much. I take my meds and I'm good. Awesome. I am so glad to hear that, honestly. Uh, these are the factors that are involved that seem to show up over and over again when you look at large groups of people with ADHD. That does not necessarily mean that you're going to get every single one of these factors in the same proportions for every single person who experiences the disorder, right? So these things, though, do seem to play a role. The higher the level of dysfunction in the family, the higher the level of stress the child experiences, and the more of these biological markers they've got in their genome, the more likely the kid is to develop ADHD. Now, this one is one that we tend to catch most of the cases of. You got roughly 80% of kids with ADHD receiving treatment. Um, Now, that in and of itself, though, while that seems very positive and is positive, I think on average, you do get a lot of ongoing controversy about whether or not we are overdiagnosing this disorder. And there is some evidence based on the most recent research that we are assigning this label and this diagnosis to kids who don't necessarily have the symptoms, or if they have the symptoms, they're short term or they're mild, right? And so they don't necessarily need the treatments, which then, giving kids treatments, and the most common treatment for ADHD, Ritalin or other types of drugs, are essentially low-level doses of amphetamines. They affect the dopamine production of your brain and increase the effectiveness of the dopamine in your brain. This is super effective for folks who actually have the disorder. It helps them calm down and pay attention uh, far more effectively, and sort of brings them onto a more even keel. Interestingly, someone who does not have ADHD who then takes these drugs may feel like they are more focused, but they do not show increases in performance. Right, so I remember as a grad student at Duke, there was a pretty big black market amongst undergrads for Ritalin, because kids, neurotypical kids, would buy it and take it when they were um, studying for their finals, because they would take this drug and then feel like they were really zeroed in, like they could really focus. However, it's a bit of a false feeling. The upping of the dopamine in your brain in those particular regions that drug affects makes you feel like you're focused, but actually makes you a little bit. It mimics a manic episode just a little bit, where the person feels like they are really zoned in and really like focused on what they're doing, but they start a lot of tasks but don't actually finish many of them. So it's not actually helpful as a study aid for someone who doesn't have ADHD. So if someone tries to sell you Ritalin or some other ADHD drug as a study drug, let them know that they're dumb. Okay, anyways, sorry, that's a little off topic. You can see there, methylphenidate is Ritalin, which is the most common treatment. However, you do get some kids with ADHD that not only take the medication, but then also get some sort of talk therapy as well. There has been a decent amount of success in treating kids with behavioral therapies, right? Where you teach the parents to use operant conditionings more explicitly and more effectively in the home. And once again, if you're rewarding a child for particular behaviors and not rewarding others, the ones that you reward are the ones that are going to show up again. And this, together with the use of Ritalin, seems to be the most effective treatment for ADHD. Now, there are some problems in our society as far as this disorder goes, where the diagnoses, which, by the way, are something like 80% male. No, I'm sorry. Erase that. That's for autism. We'll talk about that here in just a minute. The diagnoses for ADHD tend to go much more to white kids than they do to African American or Hispanic American kids. Now, this has less to do with any biological differences, it seems, between different ethnic groups, and more to do with sort of societal differences, where white kids seem to get paid more attention to academically. So if they are not behaving properly in school, it's violating expectations for teachers more. That's more likely to get reported to the parents. The parents then are more likely to then seek treatment. And given some of the socioeconomic differences that still exist in our society across different racial groups, you then have folks in minority groups having less resources on average to then buy the drugs, get the therapy that their kids may need, and just even going into the therapist are less likely to receive the diagnosis to begin with. So this is something that again we'll have to continue sort of looking at and reassessing as we try and deal with some of the racial and ethnic differences in our society, and try and improve those over time. Okay, let's talk about autism spectrum disorder. We first identified this disorder in 1943. There are three basic categories of differences that show up in kids with autism, or that are on the spectrum, as is the more commonly used term now. These kids tend to have difficulties with communication, difficulty with social responses, and they tend to have repetitive, rigid, sort of ritualistic behaviors that they engage in. These symptoms tend to show up quite early on, and in fact, one of the first warning signs that parents will frequently notice and then seek assistance for is that their kid doesn't want to look them in the eye. Uh, Interestingly, one of the strongest biological correlates of autism spectrum disorder is undergrowth of the amygdala, which is supposed to be the fear center of the brain, but is also the part of the brain that helps us look at and cue into the eye section of the face, right? So, folks with damage to their amygdala, even if they don't have, if they're not on the spectrum, will have a harder time looking in people's eyes in order to get information about the person's emotional state and what's going on with them. So there, that is part of what's going on here. This is the one that you got 80% of diagnoses go to boys. It is a spectrum, as the newish name of the disorder recognizes. You can have the symptoms be quite mild, all the way to very, very severe. Now, as many as 90% of kids on the spectrum are going to deal with some level of disability into adulthood. Um, so if you think of autism spectrum as sort of an umbrella under which a lot of people fit, you can be under a different spot in that umbrella and still be under the umbrella, still have the diagnosis, right? And so you get kids with some of the milder symptoms who may have what we previously called Asperger syndrome, which is mild social mild differences in social responsiveness and the ability to pick up social cues. That's someone who's still going to be able to keep a day job and manage their relationships, but will struggle throughout their life and feel different from the people around them because they simply don't pick up on all the social cues that other people's do, or are not able to communicate as smoothly or as easily as other individuals do, and may find themselves sort of on the outs in any new friend group, um, simply because they don't respond the same way that everybody else does. Um, so you can see there's two of these three types of problems: the lack of social responsiveness and communication problems. Now, these communication problems can show up as echolalia, which is the repetition of exact phrases over and over and over again. Um, or you can have what they call pronominal reversal, which is you confuse your pronouns. So using they instead of he or she, or mixing things up in your reference um, to other individuals, and so that can be very confusing for somebody else that you're talking with. Why does this occur, and why has the diagnosis of autism exploded over the last generation? Well, you've got once again a variety of factors involved, and there are likely others that we haven't identified yet. Um, the explosion in diagnosis cannot be entirely explained by the increase in popularity or visibility of this disorder over the last generation. So there is something, or several somethings perhaps, that have changed in our society that seem to have increased the likelihood of this disorder occurring in children, because the rates have gone up pretty drastically to the point now where it's something like 2% of kids overall and something like 5% of boys are diagnosed with autism. So, what are some of these causes? Well, family dysfunction and social stress, environmental stressors do play into it, although we don't know exactly at what level or which ones. There has been repeated experimentation now on the, for a while, popular hypothesis that it was childhood vaccinations that were causing increases in autism. That one's been pretty thoroughly debunked. So that's not it. But there do appear to be both environmental toxin factors and family factors that play into this. Psychologically speaking, we look at it from the sort of cognitive psychology perspective, the development of the understanding of the world around you and how you process your senses. Uh, Kids on the autism spectrum tend to have a hard time developing what we call theory of mind, the understanding that other people have a mind just like you do, and that their thoughts and their emotions and their state of being may differ from yours, but is every bit as valid as yours. This is something that is hard for kids on the spectrum to understand. They tend to have an incomplete understanding compared to peers their own age, and develop that understanding later and less completely than others do. So we think that there are actual brain differences that then lead to these differences in perception and differences in understanding of other states of being. Um, we don't know biologically exactly what's going on. We do know that there are some genetic markers involved. If you look at the heritability factor, you are more likely to develop this disorder if you have close relatives who have it than if you don't. So that means that it is at least partially genetic in nature. And we have identified some of the brain abnormalities and differences that occur. I talked already about the differences in the amygdala. We've also found differences in the cerebellum in terms of the mass of the cerebellum and how it functions, how it's connected to the rest of the brain. Okay, how do we treat it? Well, it depends on the severity of the symptoms. We can't necessarily fix or cure autism by any of the treatments that we've got, but we can reduce the severity of some of the symptoms and help some of these kids interact with their world a little bit more successfully than we were able to previously. So essentially, it's helping the child learn to interpret their environment and respond in socially appropriate ways, even though that may not be what they are inclined to do. So there are combinations of CBT and parental training and community programs that can be helpful. There have been attempts to use psychotropic drugs, and occasionally, in some instances, that helps, although not necessarily reliably. Far more frequently, what we do is some version of what we call CBT, where we are teaching new skills, right? Teaching kids speech behaviors that they're having a hard time picking up on. So sort of focusing in on learning speech and learning it in a more, let's repeat this kind of way. Let's learn it like it's something you learn in school kind of way rather than something you just pick up naturally, because the kid's not picking it up naturally, and so it needs a little bit more focus, right? Same thing with social skills. At the same time, you are trying to teach the kid more socially appropriate ways of reducing their own negative internal states, right? So one of the things that you frequently find with kids on the spectrum is that they will engage in repetitive behavior that's sort of disturbing to others, whether it's shrieking or hand flapping or head banging or twirling, disruptive stuff, right? Usually this is in response to unpleasant internal states. Kids on the spectrum tend to have sensory sensitivities. You've probably heard that before, where they are more sensitive than usual to particular inputs, whether that's sound or light or tactile responses. When they get overloaded, when they get too much input and they don't know how to handle it, frequently they will engage in this repetitive, disruptive behavior in order to cope with their own distress. And so teaching a child to find less disruptive ways to cope with their stress, something that's a little less loud or a little less involving a little less movement, something that's not going to disrupt the people around them, is going to help them interact with their peers a little bit better. It can be massively successful so long as these therapies are applied really early. I actually have a friend who has a child on the autism spectrum who was told when he received the diagnosis right around age 1.5, listen, you need to know that your kid is never going to hug you. He's never going to tell you he loves you. He's never going to have friends, and that's just the way your life's going to be. And she said, okay, thanks for that, but I'm going to keep doing what I can and doing my best. And so she found the right therapists and the right teams to help her out. Her son is now 14, 15. Um, you wouldn't mistake him for a neurotypical child, but he's got friends. He goes to school. Kids like him. He's fun. Um, and he tells his mom that he loves her. Right? So that's, I mean, there can be massive increases in the capabilities that these kids have, so long as you catch it early and you get them the right kinds of training so that they can learn how they're supposed to behave. And it may be something that a neurotypical child just picks up on their own. Well, these kids don't, and so you got to teach them how to do it. And so long as you teach them how to do it, a lot of times they'll be able to pick it up and do what they need to do. Okay. Communication training is also going to be a big part of that. You can have communication differences in kids on the spectrum, anywhere from mild unresponsiveness or delayed language acquisition to kids who have very severe symptoms who will never develop language. And so uh, engaging in communication training, not only sort of the language skills, but also then the social skills that are associated with talking to other people is going to be really useful. Um, oh, and last but not least, um, the most successful programs heavily involve parents, because parents are the ones who do most of the training for kids, right? Who teach a child how to interact with the world around themselves. And if your child is not picking up um, the training that you're trying to give them, that every parent tries to give their child, then you need to learn a different way to present the information to your child and learn different strategies. And so we have programs now that where you bring mom and dad in and say, okay, when your child responds this way, that means that they are missing this one particular thing, and so you need to do this instead, right? And so this, again, is going to help massively for that kid to be able to understand what they need in order to be able to interact with the people around them. Okay, I think that's all we're going to do there.